When the talking cure was pioneered, everyone who was a therapist had to be a patient. I observed that. I was a patient for many years because I wanted to learn about myself. And I had my own suffering that I had to parse out. But if you don't understand as a therapist where you begin and end, and you get into complicated psychiatric treatments with patients who are vulnerable, I think you're at an incredibly high risk to be an ineffective therapist. To preserve a frame, and whatever frame, CBT, DBT, mentalization-based treatment, garden variety psychotherapy, you have to be very, very strong in your mind and in your heart. And you have to maintain positivity and professionalism and kind regard for your patients. And to do that, you have to know yourself. Some people with their big old brains can know themselves from learning. I think that's the exception to the rule. Most of us in this field have tried at least a little bit to be a patient, to know what an intervention feels like. It helps us to be more humble. And it helps us to be empathic. And it helps us to create an attachment context in which a patient can rekindle a sense of purpose and meaning in their lives and have some kind of spiritual awakening, which at the end of the day I believe to be the core of recovery from most of our illnesses.